Hello, my name is Caitlin Gass, and thank you for joining me today as I present a study that proposes further research on magnesium deficiency and its impact on both male and female stage 1 hypertensive patients. The specific age group of focus is individuals over the age of 65. So let's start by getting into some specifics of how magnesium works in the human body. Magnesium is an important mineral found in the body with active roles in over 300 enzyme system processes. It has a role in biochemical reactions such as protein synthesis, muscle and nerve function, blood glucose control, and blood pressure regulation. Specifically for this study, we're going to primarily focus on magnesium's role in blood pressure regulation. Some primary sources that magnesium is found in include leafy greens, nuts, seeds, legumes, whole grains, avocado, milk, and salmon. And of note, magnesium is also found in many tap and bottled water. Currently, statistics show 10 to 30% of populations in developed countries are deficient in magnesium, and this can all be attributed to instances of growing chronic disease, medication interactions, and overall that the United States population has adopted a Western diet which is full of refined foods where nutrients such as magnesium have been milled out. Deficiency of magnesium can result in side effects such as weakness, tremors, cardiac symptoms, depression, and agitation. Specifically for this study, we'll be focusing on cardiac symptoms, which hypertension fits into overall cardiovascular disease and predisposes the human body to cardiovascular disease. So now let's take a look at magnesium's role specifically in hypertension. Firstly, hypertension has been identified as one of the most chronic diseases noted worldwide. The key factors that we're looking at to reduce hypertension instances is management and control of blood pressure above all. Reducing instances of hypertension to reduce cardiovascular disease complications. And the present studies focus on dietary intake, exercise, and body weight. So specifically for this study, we're going to be taking a look at dietary intake, and we'll get into how we're going to split that up in a couple slides here. Specifically, the present recommended dietary intervention by the American Heart Association is the DASH diet, which is dietary approaches to stop hypertension. It does result in an increased intake of protective nutrients. Some of those protective nutrients include calcium, potassium, and in this case, magnesium, which we're looking into further. Magnesium is to be used as an alternative to medicine in lowering blood pressure. It could have a significant impact on public health. Current studies have shown that a daily supplement ranging even from 240 milligrams to 960 milligrams per day has decreased blood pressure. So in summary, further study of magnesium and its protective properties is warranted based on the above facts in the ongoing research to decrease hypertension. So we're going to get into specifically finding a place to start, more of a baseline as to where we can focus in on how many milligrams of magnesium per day are going to actively work well to reduce blood pressure. So this is just a sampling of the present literature surrounding magnesium's role in hypertension management. We have 3 studies here. Lelong et al. Conducted a review of the relationship between nutritional status and blood pressure through the examination of just dietary intakes. Their results showed increased fruit and vegetable consumption was correlated to decreased blood pressure. Conversely, Zhang et al. Reviewed previously completed oral supplementation, double-blind randomized control trials. They used a median dose of 368 milligrams per day of magnesium, and a median time frame of study was 3 months. Their results allowed for singling out of magnesium rather than just looking at diet overall, and this showed a causal effect between magnesium supplementation and lowering blood pressure. Schwalfenberg and Genius designed literature to support clinical health professionals. So they took studies, review articles, and they really brought them together to examine the health challenges caused by magnesium deficiency. They cited that deficiency may cause resistance to certain hypertensive medications, and their review showed that 500 to 1,000 milligrams per day of magnesium may reduce blood pressure. So really taking into account all three of these studies, along with many other studies that have been reviewed, and really showing that there are two things that we're taking a look at. We're looking at dietary intake, we're looking at supplementation, and then we're really trying to narrow down what milligram dosage per day of magnesium is really going to show the greatest effect. So now we'll take a look at the proposed study. The disease process for review is stage 1 hypertension, which comes with a blood pressure reading of 130 to 139 systolic over 80 to 89 diastolic. We are proposing this set of research questions. Does consuming at least 500 milligrams per day of magnesium result in any decrease of blood pressure readings in a population of both males and females over the age of 65 with stage 1 hypertension? And when we say at least 500 milligrams, we are looking at 500 milligrams as a baseline. Basically, we'll get into it further as we look at the intervention and control groups, but one of our groups is with dietary intake. It may be more difficult to limit that to specifically just 500 on some days or a given day, but we will get into further how that's going to be recorded and give more of an explanation on where that is coming from. Again, our second question is magnesium supplementation an adequate treatment used to reduce blood pressure? So the overall goal here is to provide additional information to registered dietitians and other healthcare providers on non-traditional dietary measure to reduce stage 1 hypertension. Recruitment of participants will be in partnership with Northern Light Health. And this is a healthcare system with reach through much of the state of Maine. It would be best to partner with a healthcare organization. That way we'll be able to keep our participants' medical information and identifying features private. There will be a 3-month recruitment period for all newly diagnosed stage 1 hypertensive patients over the age of 65, both male or female. We will provide literature and understanding to the Northern Light Health internal medicine and family medicine practices, and they'll be able to propose this study to their newly diagnosed patients at their regular scheduled visits. These patients, once provided literature, will have 2 weeks to make a decision on if they would like to participate. Outreach will then be made to them after the 2-week period. If they are interested in participating, they will need to come back into the office to sign a consent form that will then be provided to the study administration. We will be reviewing 508 participants. There will be 2 groups, a control and intervention, with 2 subsets per group. Blood pressure readings will need to be taken prior to the study and recorded and submitted to the study administration. So now looking at the 2 groups that we aim to review, we have a 6-month study period, and a study number will be assigned to protect the identity of each participant. Our first group is oral supplementation. This group has 2 subsets of both 127 individuals, based on dividing that 508 total participants into 4 individual groups, or 2 groups with 2 subsets. Oral supplementation will take place through a double-blind randomized control trial. The intervention will be a morning supplement of magnesium taken with their food or meal. The supplement will be 500 milligrams of magnesium. The control group will be no change to diet and no additional supplementation, and they will be required to report daily when they do take their supplement to confirm they are participating. Our other intervention group is through the DASH diet, or reviewing dietary intake. And we can go back to what was discussed in the literature review, showing that the 2 main focuses of how we can review magnesium's effects on hypertension really is through oral supplementation, through a daily capsule, or dietary intervention. And so here we'll look at the dietary intervention piece through the DASH diet. Individuals will be broken down again into 2 subsets of 127 individuals. The intervention will be adherence to the DASH diet, 7 out of 7 days a week for 6 months. So every day per week, they'll need to have an intake of 500 milligrams per day or more, as discussed. It may be difficult to limit that in the diet, but they will be required to consult with a registered dietitian prior to the study start to really gain knowledge, understanding. They'll be provided literature and contact information for the registered dietitian to really help them through the process of adopting this new dietary intake pattern. They'll be required again to report their dietary intake online for monitoring. This will be basically them inputting what they eat during the day, and the study's online portal will be able to calculate the milligrams of magnesium in each of those different food items. So the control group for the dietary intake review will be no change to diet and no supplementation. The analysis that we intend to see and the data that we intend to see in results of this study is going to be done through a quantitative analysis, comparing that of pre-study blood pressure readings and post-study blood pressure readings. We're going to aim to calculate a percentage of increased blood pressure readings and decreased blood pressure readings for both intervention groups, that being intervention with the magnesium supplementation versus magnesium intake through dietary intake. We're really reviewing to see if one is better than the other. We expect to find a decrease in blood pressure in both intervention groups, but with this average of percent of decrease, we're really going to see if there is a difference between just taking in a supplement versus changing your diet for a long-term lifestyle change. We expect no change or slight increase in both control groups, that is, the control through dietary intake and the control through the supplementation. These groups are going to be closely monitored throughout the 6-month study by the individual's physician. Since they aren't receiving any treatment for their stage 1 hypertension, we'll just need to make sure that their blood pressure isn't spiking or dropping drastically. The results average to show a mean decrease in blood pressure will allow for a bigger picture, again, of what works better, dietary intervention or oral supplementation. This study will present future opportunities. Firstly, additional evaluation of magnesium as a treatment for early stage hypertension is really going to kind of get the ball rolling on that aspect of treatment. Changing clinical providers to looking at more of a dietary or supplementation change versus just prescribing the age-old hypertensive management medication. Again, a shift in how medical professionals aim to treat hypertension. This will also provide further knowledge and additional skills on how to educate patients on a lifestyle change rather than a quick fix. This will provide further isolation of other protective nutrients such as calcium and potassium to kind of come to the forefront. It may spark interest in reviewing similar studies on other protective nutrients. And this will also aid in viewing magnesium used to control hypertension as more of a conventional treatment versus a non-conventional. And all in all, more concrete and consistent evidence of magnesium's role in hypertension management is really going to come to the forefront and really start to make people think about other opportunities for treatment of hypertension. And here are some of my references that were used in coordination of this study. I appreciate you taking time to go over this information with us, and please let us know if you have any questions.